And if you have children in the room, our first topic, it might not be suitable for them watching right now. So you might ask your kids to go run in the other room really quick. Now, we're taking a look at Conception's Reproductive Associates of Colorado. For nearly 20 years, their team has been leading the field of reproductive medicine. Their fertility specialists have helped hundreds of couples have families of their dreams. It's really exciting. Today, Dr. Robert Green is focusing on egg freezing. This area of fertility continues to be in the news more and more, and companies are even offering this option to their female employees. And it's nice to see you, Doctor.
Thank you. Nice to be here.
I love that you're on the show, especially Conceptions. I've had a couple friends that has a lot of success through Conceptions. One of them has a 3-year-old daughter now, thanks to you all.
We love hearing that.
That's wonderful. So why might a woman choose to freezing her eggs?
Well, it's a great question. The most common reason that's been looked at in a variety of research studies is really just not currently having a partner. The procedure itself has sometimes been described as a bit of a technical bridge between when a woman is most fertile and when she's most interested in actually starting her family. So sometimes people want to pursue their career, complete some educational goals, or maybe just travel and delay, having their children a few more years. But those few more years can be sort of costly when it comes to fertility.
Explain the concept of ovarian reserve.
Ovarian reserve is our best way of estimating a woman's current fertility. It's a way of estimating how fertile she is compared to other women the same age. Not everybody starts out as fertile as anybody else. And this is a simple way of saying this is how fertile you are. And then over time, you can actually repeat the test and see how rapidly it's changing as well. Sometimes the test will identify someone's not as fertile as you would expect based on their age, and that's a good thing to know while you still have the eggs and have the option to actually do something to preserve them.
Yeah, this is so fascinating. If you're interested in starting a family, you may need a little help, or maybe you want to freeze your eggs and hold off on starting a family, but make sure that's a priority in your future. You can call our friends at Conceptions Repro right now. ConceptionsRepro.com is their website, or call 303-794-0045. Now, we have a couple pictures here, Doctor, and I was hoping you could tell me what we're looking at.
Yeah, basically what you're looking at there is an unfertilized egg, and it's being held in place by a glass pipette. That's what you see off to the side that's actually holding the egg steady.
Okay, interesting. And here are several eggs?
Basically, the first screen there on the far left is just 2 unfertilized eggs. Oh. And then over time, it's just showing how they start to develop after they've been fertilized.
Isn't that amazing? How is the ovarian reserve tested?
It's really a simple blood test. It's not expensive at all. It measures a specific hormone called anti-Müllerian hormone. It's a hormone that's only made by immature eggs. Mm-hmm. So it's a pretty simple calculation that as a woman has fewer eggs, the number goes down over time. So
this actually can tell a woman if she is going to have any fertility problems? It doesn't matter at what age?
It's very useful at any age. Typically, we don't really recommend someone start checking it until their mid to late 20s. Okay. But it's a great, any time a woman has the test, it could also serve as a baseline. It's kind of like knowing what your weight is, and then you're able to check over time and see if you're gaining or losing.
You mentioned not having the test until your 20s. What about egg freezing? Mm-hmm. When should a woman kind of consider that option?
It's a great question, and it's really an individualized approach, but medically the ideal time tends to be between age 30 and 38. Okay. Studies show that if a woman is younger than that, she's probably better off just measuring her ovarian reserve, and if that looks fine, just wait a few years. But the ideal eggs in terms of egg quality are usually produced before a woman is 35. So if you freeze those eggs when a woman is in her early 30s, if she wants to wait 10 years and get pregnant when she's in her early 40s, she'll have very high success rates.
So how effective is egg freezing? Is it guaranteed if you take eggs, they're going to work no matter what?
Yeah, it's not guaranteed, like most of biology, but it's very, very effective. The thing that's important is each egg, like that beautiful egg that we saw the picture of earlier, each egg has about a 2 to 12% chance of becoming a baby. So not every egg is going to actually become a baby, and we usually recommend that women freeze about 15 to 20 eggs for every 1 or 2 pregnancies that they want to have.
Well, what I really love about you, honestly, and this is off the script here, we were talking before we even came on the show kicked off today. You moved from New York, and one of the reasons why you moved here is because Conceptions has such a high response and return where you can measure on how many children are born, which is wonderful.
Yeah, you know, we're in a very unique field. We're the only medical specialty that reports to the Center for Disease Control and Prevention in terms of success rates, because our successes are easy to measure as pregnancies. And Conceptions has one of the highest rates in the country, and yet offers it at a very reasonable, often less expensive than other centers. And that's something I really believe in.
Again, it's worked for a couple of my friends for sure. So you guys do a wonderful job. Call right now if you're interested in possibly freezing eggs, or maybe you want to start a family and you need a little help. You can go to the website at the bottom of your screen, which is conceptionsrepro.com, or the number right there, 303-794-0045. You'll be in great hands. They'll take great care of you. What would you say to a woman who maybe has to undergo cancer treatment, or maybe they're even in the transgender process? I mean, that's something that's happening these days, but they still have their ovaries.
Yeah, absolutely. In fact, there was just a reported case 2 days ago of an 18-year-old transgender student that was freezing eggs before going to college and undergoing gender reassignment surgery. So that's becoming more common. But a much more common thing is actually we do see many patients that have been faced with a diagnosis of cancer, and the reality that their treatment will likely cure their cancer but cost their fertility at the same time. So we regularly freeze and store eggs for people that are planning cancer treatment. And in fact, there's even grants available to get that paid for people that are dealing with that, because they're dealing with a very short time zone and they don't have a lot of time to budget for it.
Now, doctor, you mentioned grants, but what about insurance? Does insurance cover this at all?
More and more. In fact, it was announced just last year that Facebook and Apple are both covering egg freezing for their female employees. And again, a lot of women are sort of hitting the peak of their career. They're not quite ready to start their family. And so, you know, a lot of the more progressive companies are saying, you know what, we want you to be able to have the security to give your full attention to the job and still have the family when you're ready.
Absolutely. Many women are forced to be the provider of the family.
Exactly.
And so they have to make sure security. Or choose to.
Exactly.
Absolutely. Thank you very much. It was so great having you on the show.
Thank you. It was a pleasure.
Valuable information. For more information about Conceptions Reproduction Associates of Colorado, please visit their website at conceptionsrepro.com, or you can call right now, 303-794-0045. And today, our friendly doctor, Dr. Green, is offering a $90 consultation for anyone who calls and mention that you saw Dr. Green right here on Colorado and Company. So save a lot of money. Normally, that's a $175 consultation fee. You're only paying $90 when you mention Colorado and Company. The number, 303-794-0045. The caring professionals at Conceptions Reproductive Associates of Colorado paid for this segment.